Yeah. One of the things that we learned during this access crisis is that as strong and as big as VA is, it can't do it alone. And we need to work closely with community providers, those providing healthcare in the private sector. And so right now, about 25% of all veterans are getting their care in both the VA and in the private sector. And we believe that's a good thing. And what we're trying to do is actually build a seamless, integrated system of care that takes advantage of what the private sector does best and what the VA does best, because that ultimately is what's best for veterans, to get the highest quality care available in the private sector and those services that are available in VA that aren't available and accessible in the private sector. So it's a one integrated system that we're building. VA has a mission unlike any other healthcare system, that is to provide care to veterans no matter where they live. So we are responsible for providing care to veterans where we don't have any facilities there, to every nook and cranny of this country and beyond, actually. And so in order to do that, we need technology. It's the reason why VA is by far the largest provider of telehealth services. Over 717,000 veterans get care through telehealth. 12% of all veterans are getting their care through telehealth services. I myself, I'm a practicing internist. I practice in person in New York City, but I also take care of patients in Grants Peak, Oregon, through telehealth from my office in Washington. We have a great need for healthcare professionals to join us. We have 46,000 job openings as we speak today. So wherever we can, we're trying to get the word out that VA is a great place to come and to work and to serve, and no better way than to have your career in the VA. But as you said, our job is to provide care to wherever veterans are, and sometimes that's in areas where there aren't many healthcare professionals, and it's hard to get people to want to move to those communities. So that's where we are leveraging the size and scope of the VA, and we are using telehealth to have experts from areas where we have people that are working there to be able to use their expertise to serve veterans in those tougher communities where we don't have as many healthcare professionals. We are talking to the Public Health Service about such a program where one of the ways to serve and to give back would be to serve in the VA. We are certainly working with all of our academic partners to make sure that the residents and the students that we train look at VA as an option for continuing their service after their training. And we are certainly open to other types of programs with associations or other groups, even looking at retired physicians who may want to come back and to serve even in part-time roles to be able to help us. And we have literally thousands of people who volunteer their time in programs like that where they come back and give time to give back to veterans. Thinking on this has not changed since the beginning. And the way that you make tough decisions, and this has been a tough decision because we've gotten so much feedback, literally thousands and thousands of people have contacted us in the comment period about their strong feelings about giving advanced nurses additional independent ability to practice. But the way that we've dealt with this always is through principle-based decision making. And our principle has been that our number one priority is to provide access to veterans. And we are struggling, as I talked about, with 46,000 job openings to provide enough access to veterans care. So given that principle and given the fact that we need to have as much quality health care as we can to our veterans, we have decided to support full practice authority for advanced practice nurses. And we are moving forward with that. We have indicated that this is our intent to have a rule to seek full practice authority, and we will continue with that. The comment period's over, and we're waiting now for our final publication period of that rule. However, we have also, using the same principle, decided that in the use of certified nurse anesthetists, that we currently right now in the VA do not have an access crisis when it comes to anesthesia care. We have, fortunately, 900 great certified nurse anesthetists who already work for the VA, and hundreds of well-qualified anesthesiologists who work together in team-based approaches to care that's working well in serving veterans. So we are not seeking a change to our current practice as it comes to CRNAs.